Hey guys, Dr. Ray Marque here, your local chiropractor at Back Pain Relief Center. This is our latest episode of Dr. Ray TV. All right, so I know it's a little later. It's about 6 o'clock. We just got so busy today, I couldn't get away to give a little talk and go over some things that I'd like to get over. We've been at our busiest time ever here. We're getting a lot of walk-ins, a lot of people coming in and getting some neck and back pain relief as quickly as they'd like it. So a couple things here, and I'm going to go over this just because I saw 3 patients today with the same exact thing. And this is a upper thoracic or scapular or shoulder blade pain. And it's kind of that feeling that you get kind of right near that shoulder blade, lower than the neck, a little higher than the bottom of your scapula. And you kind of get one little spot there and you can kind of push on it and it feels like a little bit of pain. Or a lot of pain, really. So let's talk about that a little bit. So what is it? Number one, that pain that you're experiencing when you come in, I can palpate or push around on it and feel one exact spot that is an area of concern. And you feel tenderness when I push on it. Some patients, when we push on it, feel some pain shooting down their arm or up towards their neck. That's a muscle spasm or myospasm. And it's usually a condition associated with repetitive stress disorder. So either you're doing something, the same thing day in and day out. So maybe you work at a factory and you're doing the same thing day in, day out, like a lot of the people over at Duran Glass and all that kind of do the same thing. Maybe you're a new mom. So one of the patients today was a new mom, had a 1-year-old and constantly picking up and down and picking up and down. And some of these muscles start to get just a little overused. Where else do we see it? The young man, or the man we had in today, was a forklift driver. So all day long he's bouncing around and his hands are forward, and all of them can pinpoint the pain in that same exact spot. And you ask, well, why can I find it and why are they all having the same spot? Well, we have this big muscle, and it kind of starts right here, our trapezius muscle. And that muscle kind of hooks onto our shoulder, goes up to the base of our neck, and it goes down to a T or to a point at the bottom of our back. And I don't know why I stand, you probably couldn't see that. But a big diamond-shaped muscle. And that muscle is responsible to hold our shoulders back and to keep our head up so it doesn't fall over. But when our head slides forward and our shoulders slide forward, that muscle has to flex all day long. So imagine if I were doing curls all day long. So if I were doing dumbbell curls all day long, my muscles would start to get sore. After they were sore for a while, they would get tired, and then they would finally spasm, right? So they would get tight or cramp up. It's the same situation. That muscle works day in and day out, and it starts to get tired, it gets overworked, overstretched, and it spasms. So when we have a muscle knot, and that's that knot that we can push on, it spasms, it starts getting less blood flow there, it becomes ischemic or not enough oxygen there, and it gets painful to the touch. So I'm just looking at my notes here. What do patients report? They come in and tell me, what do they say? Well, a lot of them say, well, I turn my head a certain way and I feel it over at my shoulder blade. And when I do that, it's really a sharp pain and it shoots up my neck a little bit. Sometimes I feel it go down to my mid-back and sometimes down to my arm. And it's just a certain spot, and they all kind of do this and they move their neck and they're trying to get it to work out and they just can't get it. And that's because those muscles connect up into our neck and that's our mid-back, and it's all connected, and we move the head one way, we irritate that spot. What else do they report? They report sometimes it's a sharp pain, sometimes it's a burning pain, sometimes it's a numbness. Always hurts more to the touch. And everyone always thinks, hey, if we can just work that out, it would feel better. And they're partially right. Other patients report, and like one today, one had trouble working because he couldn't do the performance that he wanted to do. Other ones can't sleep. They can't get in a comfortable position. Some of them have trouble moving their arms. So this simple muscle knot for an extended period of time from a repetitive stress-like disorder can cause all kind of havoc. And once you have it, then it's hard to get to go away. And I think I have a question here. What do you recommend for severe muscle spasms? Well, there's a lot of reasons why we get muscle spasms. So for this particular type of spasm, number one, I would use some heat on it. All right, and this is what we did with the patients in here, and we'll get a little more specific. And I can't see who asked that question. Taylor. Hey, Taylor, what's going on? So severe muscle spasms, I would start with some heat, okay? I would heat the apply together. And if you can get to it, use a heating pad, a nice long hot bath. try to stretch out the area. If it gets severe enough and it spasms enough and it's not a cramp, a TENS unit. And a TENS unit, electrical unit, they make some over-the-counter ones. You get them at CVS, Walmart, Target, all those places, and you can put it right on the affected area, and sometimes that electric going in there will help. So I just answered that question. That's kind of cool. That's the first time I've seen a question on live video. What else? Who was watching? Hey, Brady, what's going on? All right, so here we go. So back to our scapular or our spasm pain near that shoulder blade. So what needs to be done? Well, on a very conservative way with a chiropractic care, what we're going to do, we're going to bring you in the office. I'm going to do an exam. On the patients today, I took some x-rays because they had it a little while. I took some x-rays of the neck and the upper back. I wanted to see if there's any indications of some vertebral misalignments or some degeneration in the joints that could possibly be affecting the nerves that are supplying that area, and see if we have to worry about that neurological component to this spasm. And one of the patients had a little bit of component that I think we had addressed, another one didn't, when it was more of a muscle thing. So the first thing we do, I go in there and I use my fingers and we use our hands and we do some trigger point therapy, we do some active release, and we physically try to break that knot up. When we physically try to break that knot up, it can be a little sore, it can be a little uncomfortable, but we're actually getting in there and trying to loosen things up to get the back to work the way it's supposed to. The next thing we did is we used our adjusting instruments to try to, again, break up some more adhesions, realign the vertebrae so they don't contribute to this part. And then we go and we do a spinal manipulation to most likely the neck, the upper back, and many times the shoulder and the scapula to get everything to balance, to get it working correctly. All right, so after we did our trigger point work or muscle work, or sometimes they call it myofascial work, then we did some spinal manipulations and some extremity manipulations to get the whole area to function correctly. And then the next thing we did some electric stim, just like I told the one person to use a TENS unit. We use electric stim unit over that area of pain. We put some heat on top of it, and we're trying to loosen it up. Okay, so after the muscle work, the adjustment, and then the electric stim, we put them on our roller beds, and the roller beds further going to work out some of the muscle knots in there to allow for better mobility to work out the muscles. Again, so how does all this happen again? This is usually a biomechanical dysfunction or an overuse syndrome. Maybe you're at work too much, maybe you're under some stress, maybe you haven't been sleeping, and it all kind of adds up to that. Let's say we do a few treatments. So I told all the patients today, hey, let's come 2 or 3 times. We should be able to get you through this fairly quickly. We gave them some home exercise to do. We gave them 10 units to use at home, some biofreeze. They're gonna treat it every day at home. They're gonna come see me a couple times. If that weren't to get bad, say this spasm has been there for a long, long time, and some of them have been. Some of them take a little longer to resolve. If we're not getting there as fast as you'd like us to get there, or it's getting worse, what I would do is refer you out to one of our medical doctors. Sometimes they can give you some appropriate medication, whatever that would be for you, whether it's an oral steroid or maybe a muscle relaxer or maybe just a strong anti-inflammatory, and that helps it in conjunction with our treatments to speed this whole process up. If all that didn't work, I've seen them in the past do some trigger point injections where they put a needle in there. Sometimes they put a little lidocaine or something like that, or whatever they think is appropriate, and that muscle knot subsides. Okay, again, so hopefully that helps you out there. If anyone's watching and they have this disorder and they want to talk about it, just message me on Facebook, and I'll respond to all of them. You can always call me at the office. For more information, you can always reach us at backpainrc.com. If you're up here in New Jersey, if you're down there in South Carolina, it's Murrells Inlet chiropractic.com.